Can you tell the difference between this image of a brain and this one? The one on the left is an MRI of a normal brain, while the one on the right is an MRI of a brain affected by multiple sclerosis. As you can see, there are tiny little white lesions on this brain affected by multiple sclerosis. These indicate abnormalities. The Multiple Sclerosis Foundation defines MS as a chronic neurological disorder that affects the brain and spinal cord. The central nervous system, nerve fibers are surrounded by a layer of insulation called myelin. Myelin allows nerve signals to travel properly. This myelin is destroyed in a person affected by MS. This causes scarring that disrupts the transmission of messages, which delays the functions of the nervous system. More and more people are being diagnosed with this disease today, which is why I believe it is important to learn about. I will now inform you of the signs and symptoms that may occur associated with MS. These signs and symptoms were reported by the National MS Society. You do not have to have all the symptoms to have multiple sclerosis. They can include fatigue, numbness, walking, balance, and coordination problems, bladder dysfunction, bowel dysfunction, vision problems, dizziness and vertigo, sexual dysfunction, pain, cognitive dysfunction, emotional changes, depression, spasticity, speech disorders, swallowing problems, headache, hearing loss, seizures, tremor, respiration and breathing problems, and itching. There are other symptoms that are less common than those previously mentioned. Next, I will talk about the incidence of MS, which is how common the disease is. More people are being diagnosed today than in the past, and those who are diagnosed are most likely between the ages of 20 and 50. MS is more common among Caucasians than any other ethnic group, and finally, MS is at least 2 to 3 times more common in women than men. All of these statistics were provided by the National MS Society. The cause of MS is unknown, but scientists believe a combination of factors are involved. As reported by the Multiple Sclerosis Foundation, MS is believed to be an autoimmune disease. The immune system reacts against normally occurring antigens, which means the body is acting against itself. Some data suggest that a common virus or other infectious agent may play a role in the cause of MS. Some of these viruses and bacteria can include Epstein-Barr, chlamydia, pneumonia, and measles. Other evidence suggests the geographic location has an effect on who gets MS. MS occurs more frequently in locations further from the equator. This is due to less intake of vitamin D from the sun. Genetics may also play a role, however, it is not considered a genetic disease. In a family in which one parent is affected, children have a 2 to 5% chance that they will develop the disease. There are currently 5 tests to be performed in order to be diagnosed. First, a medical history and neurological exam must be conducted. Next, an MRI to view the brain to see if there are any abnormalities. A visually evoked potential, or VEP, may be conducted, which is a procedure in which electrodes are placed on the head and body. The response is recorded to determine where delays in the nerve transmission occur. Another test is a cerebrospinal fluid analysis, which is also known as a spinal tap. Blood tests are also conducted to rule out any other possible disease. There is currently no cure for this disease, however, there are many options to help relieve the symptoms. There are interferon injections, such as Avnex, and other disease-modulating drugs, such as Tisabri, which are intravenous infusions. All of the drugs have the same purpose, which is to keep the disease in remission to control symptoms. The patient's neurologist will decide which is best for the person affected. These treatment options were provided by the Cleveland Clinic. It is difficult to predict the course of MS because the disease varies from one person to another. Most people with MS have a normal life expectancy. The prognosis really depends on the stage and course of the disease, and there are 4 courses. The first, relapsing remitting. This is the most common course. This is categorized by partial or total recovery after attacks. The second course, secondary progressive, a relapsing remitting course that later becomes steadily progressive. The third, a primary progressive course, which is a progressive course from the onset without any attack. The symptoms generally do not remit. In the fourth course, progressive relapsing, a progressive course from the outset with obvious acute attacks. This is the least common course. You're probably wondering exactly why I'm speaking about multiple sclerosis. My mother was diagnosed over 17 years ago. There has been recent talk in the media about MS with the death of Annette Funicello. It is important for people to understand the disease and the different courses it takes. My mother is proof for people that are diagnosed with the disease that is not always grim as the media portrays. Some of the factors in progression of the disease cannot be helped. However, the person's attitude and willingness to recognize their obstacles and triggers can help to manage their disease better. Attitude and family support is an important and vital component to fighting this illness. My mother shared with me this quote that helps her get through every day. I have MS, but MS does not have me. If you have this attitude, then this disease should not bring you down. Thank you.